Welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price, and I'm a physical therapist. Today, I want to share some information on resveratrol and how it can be beneficial to the female athlete as well as an individual with osteoarthritis. And I'm going to be referencing a 2022 review article. Resveratrol was first introduced to me back in 2007, and I found it interesting. And at that time, all I did was have the experience of using resveratrol to see how it affected the body. And as I saw it becoming beneficial, I wanted to learn more about this. So I want to shine some light on some of the benefits of resveratrol. One, resveratrol is going to help protect the joint by two different pathways. So it's going to prevent apoptosis. Apoptosis is when the cell dies, and so it helps to keep the chondrocytes, which are the cells that produce cartilage, it keeps them alive. So it helps with cell proliferation in the joint, and that can protect the cartilage. It also inhibits the COX-2 gene pathway, so it acts as an NSAID, which is a non-steroidal anti-inflammatory agent, and that is going to follow the anti-inflammatory pathway to reduce inflammation, which then can lead to a reduction in pain in the joints. And it has been found with postmenopausal women that have joint pain, the resveratrol can help reduce the pain in the joint. And then the question is, well, why in postmenopausal women? So resveratrol also has an estrogenic effect. So it is found or thought that it can mimic estrogen, and that can act kind of as an anti-inflammatory, and that will alleviate pain in that aspect. So then let's go think about it in relation to the female athlete, the female runner, and the menstrual cycle. So there's two phases of the menstrual cycle: the follicular phase, which is the first 2 weeks of the cycle, and then the luteal phase, the second 2 weeks of the cycle. And the estrogen is going to be highest in the first 2 weeks, with progesterone a little bit lower. And then it's going to flip-flop, and progesterone is going to rise in the second 2 weeks, and the estrogen is going to drop. If you follow your cycle and you have pains or chronic injuries in your body, you may notice that the pain shows up the 2 weeks before your menstruation. And that is when the estrogen is low and then the progesterone is higher. Well, when the estrogen drops, you lose that estrogenic effect of that anti-inflammation. So it helps to modulate inflammation. And that's where resveratrol can come in and possibly help with some of that pain. So for the female athlete, if there's any chronic injuries or overuse injuries in runner, or coming back from an injury and healing, you may want to use resveratrol in the second 2 weeks of your cycle to see if you can help with some of that healing and pain. And that is going to be one way that you can address some of the chronic pain in your body. Resveratrol is something that you could try if it is going to be appropriate for you. So you want to discuss this with your healthcare provider for your particular needs. And if you are sensitive to estrogen, then it is something you may want to consider to shy away from. And those are just some of the benefits of resveratrol and how it can help with osteoarthritis, as well as to be a pain modulator. And I hope this is of help. Have a blessed day. Thank you.